Hi, I'm H.D. Chambers, Superintendent of Schools for Alief ISD. I trust everyone is doing well, and I am here to bring a message to our students, our staff, our parents, and our community regarding the next steps as we begin phasing into the next part of our school year. As you know, we are in the process of beginning to phase very small selective groups of students and staff members to begin returning to school for in-person learning. And those students that we're phasing in are obviously going to have an option, their parents are going to have an option of continuing with Alief Learns at home in a virtual environment or coming to school for in-person instruction. We have, believe it or not, we have had a very small select number of students that have been in our schools this week being tested in a very controlled environment. But starting next week, Monday, September 21st, we will begin welcoming our first group of students for in-person learning whose parents have chose that. And this is a very small select group of students. I want to be really clear. This is only for students who have been identified and have already been contacted by teachers, by staff members, by the school district. And these are many of our students in our special education and special needs programs. They are, as I have mentioned before, they have been our most vulnerable students during this virtual environment. And so we have been working diligently in monitoring the health conditions of our community and the greater Houston area to a point where we could actually begin bringing these children in for in-person instruction. So next week there's going to be a small group of students that begin coming into our schools. So everyone, community members, parents, you're going to see buses running next week. You're going to see Alief ISD buses running next week. But please know, schools are not all open across the district. This is not for all children, all students. This is a very small group of special education students for the week of the 21st. The following week, we will go to phase 2. Next week, the September 21st week, is our phase 1. The following week, the week of September 28th, we will begin welcoming another group of students into our schools whose parents choose to allow them to come. And I want to be really clear that Monday, September 28th, is a staff work day. So there is no school on Monday the 28th. There is no school virtually. There is no school in person. So please know that Monday the 28th is a student holiday. But for staff members, they'll be working. But beginning Tuesday, September 29th, in addition to those special education children I just mentioned for next week, the 21st, we will also invite our pre-K and kindergartners, for whose families who want them to come back to school for in-person learning, as well as 5th and 7th graders. So the week of the 21st, special needs children. The week of the 29th, that Tuesday the 29th, will be pre-K and kindergartners and 5th and 7th graders. That's it. So everyone else, be patient. After the week of the 28th, we will have a week break for everyone to kind of catch their breath and take a fall break, if you will. And then beginning week of October the 12th, which is a Monday, we will begin welcoming all other grade levels back that have not been phased in yet. And again, all of this is based on parent choice. So for those parents who choose to keep their children at home, to continue learning through Alief Learns, that is perfectly acceptable. For those parents who have chosen to allow their students to come back for in-person, obviously that's acceptable as well. I ask for your patience, talking to parents and students now. I ask for your patience as we staff and make sure that your child is in a classroom and has their schedule, because it's going to be a coordinated effort between those children who are still learning at home as well as those children who are going to be in person. Our principals and our staff and our leadership team have been working diligently in building a schedule and a process to make that as smooth as possible. But I'm going to tell you, some are going to be frustrated. Please know the schools are going to be frustrated. But just allow, I'm just asking for some patience to allow the kinks to be worked out as we work through this process. Please know as a parent, please know if you choose to allow your child to stay home and continue with Alief Learns at home virtually, your next opportunity to be able to choose to put them into in-person will be at the end of this second grading period, at the end of the semester. So Make those choices wisely, please, and think through the process for you and your family and your child when you make those decisions. Talk about the health conditions and the issues that surround all of the decisions being made as it relates to safety and health. We have on our website, it was placed there earlier this week, a link called Reopen. It's basically the reopening of schools. I encourage every one of you, if you haven't done so, to click on that link. It's on the home page, the reopening of schools, and it will take you to a website that will give you all kinds of options as to what to look at. It's got our safety guidelines, our health guidelines, it's got our health metrics, it's got frequently asked questions, it's got a lot of information that has been collected and provided to be as transparent and as open as we possibly can. We're going to have a dashboard that's going to demonstrate and be updated almost daily on the number of positive cases in our district. We will be reporting those out. I don't think anyone I don't think we're not aware that we're going to have cases, both staff members and students, and we have a process in these guidelines that talks about what happens when we have a student test positive or a staff member test positive on a campus. We have a process for that, and we will follow that process. And I just want you to know that if you want to read and be familiar with that process, go to the website, look at that link on reopening, and you'll find where it talks about the issues of safety and health protocols. So we're using the science, we're using the data. I think everyone is aware, if you're paying attention, that the number of positive cases, the percent of positive cases, the hospital bed utilization, the transmission rate are all going down, not only across the state of Texas, but they're going down in the greater Houston area and in the city of Houston, as well as Harris County. As you know, our district is partly in Houston and partly in Harris County. We're using all that data. The trends for our community are extremely positive, and we are using the data from the Harris County Public Health, and we're using data from the Texas Medical Center. And those are our two key resources of experts that I speak to every other day almost, in terms of what kind of information, what kind of data they're providing us. So we will continue to monitor that, and if anything changes, I will act accordingly. But I want everyone to know that we're going about this in the safest, most reasonable, methodical way that we possibly can, trying to protect all adults and protect all children, while giving parents choices about how their children are educated. I want to talk real quickly about the health and safety. Part of our process, and many of the employees have already realized this. Employees, you're going to get an email every morning, and it's a health screen, and it's takes 30 seconds to answer, and it makes every employee, including me, answer a series of questions about our health. And it's intended to be a red flag to make sure that we don't have any symptoms that might lead us to think, or might lead one to think that you might either be asymptomatic or symptomatic carrier of COVID. So every morning, we expect every employee to go into that, check their email, open that link, answer the questions. Assuming you answer them in the affirmative, then you'll be given a green check, means you can go to work. If you have any of the symptoms, I encourage you to mark those, and it'll tell you whether you're allowed to go to work or not. The reason I'm saying this is because parents, I want you to do the same thing with your children. And this is important. This is really important. All of us who have been parents who have had school-age children, at one point in time, we sent our kids to school, in some cases, thinking they were sick. They may have been sick, they may have not, but they go to school anyway. We all know kids come to school with all kinds of, they got germs, they runny noses, they're coughing, they're sneezing. But moms, dads, grandmas, grandpas, what I'm asking you, that if you have a child who's running a fever, if you have a child that's displaying any of the symptoms that the health screening issue that I just mentioned, please keep your child at home. Please, please. I realize you may think it's just allergies, or you may think it's something that they get every year this time. And that may be true. That may be true. But we encourage you to make sure that that's what it is, versus taking a chance and sending your child to school with with symptoms that might be COVID. I know it's going to be hard for you to make that judgment. I understand you're not a physician. I'm not a physician. But I'm asking you to be cognizant of that and be patient, be aware that it might be something more than just allergies or a runny nose or a sniffly nose or what, a cold or whatever whatever you might have thought it had been in the past. The same request goes to staff members, is to be smart, to be honest, and you know, between the self-screening, wearing a mask, and then socially distancing to the best of our ability, we can mitigate the spread of any type of COVID in our school district, and we will be able to maintain a healthy face-to-face instructional environment and grow it over a period of time as people become confident that they can send their children to school. So I'm asking that people be really sensitive about this as we begin opening up and not be complacent, because when we get complacent, that's when we start making mistakes and things can occur as it relates to the virus. The last thing, to the community, to everyone regarding the health conditions, continue wearing your mask, please. Continue socially distancing. You know, we're being told, I mean, you watch the news just like I do. You read articles just like I do. There is a concern that there's going to be another wave, if you will, of COVID once the season starts turning cooler and once flu season gets here. So the point of this is that we're going to begin seeing children with the flu and adults with the flu, and I know everyone's being encouraged to get a flu shot this year. If you get a flu shot, that's great. I encourage you to do it, but that's a personal decision that everyone has to make. But I would think about it, I would research it, and I would talk to my family physician, if you have a family physician, about getting a flu shot, because we don't want to combine the flu with COVID. I know everyone's concerned about that. But I'm just asking you to practice good safety protocols with socially distancing, wearing your mask, and then doing the self-screening every day like we asked. And we believe we can control the possible spread of COVID in our district and our schools. So with that, I'm gonna end. I appreciate everyone's attention. I appreciate everyone's patience. We have an issue that I want to end on. I know I said that earlier, but I'm really going to end on this. But right now, school districts across the state of Texas, particularly school districts in large urban areas like ours, our enrollment's down. In other words, we were expecting more students to come to school this year than have shown up. And this is true in Alief, it's true in the greater Houston area, it's true in the Dallas area, it's true in San Antonio, Austin area. And we have a lot of students in Alief. We have a lot of students in Alief right now that we don't have in school. And I realize we're virtual, I realize that. I am imploring family members, community members, staff members, that we do everything we can do to identify those children who are not enrolled in school and get them enrolled. They're out there, they're somewhere. And we just have to work with the families and the students to make sure they get enrolled. Some of them are not enrolled because they didn't want to do virtual. Some of them didn't want to do virtual. Some are not enrolled because they're 4 and 5 years old and they just were frustrated with trying to use technology in their house, and I understand that. But as we begin phasing in face-to-face, I want to make sure that every family member, every person out there is aware that we are now opening, and the option of sending your child to school face-to-face in a safe environment is there for you. So I'm going to talk more about this enrollment issue soon, but I just wanted to kind of plant it in our community's minds that we really do need to find the children we were expecting to be at school who are not, because it has two implications. It has, most importantly, the academic and social and emotional implication to that child by not being in school, first and foremost, and there's also a financial implication to our school districts. And so we all are in this together. All of our school districts are suffering through this, and we're working together, trying to work together to resolve it. In the meantime, I'm asking the Alief community, the Alief staff, the Alief parents, to let's try to help ourselves out and find these children. So with that, thank you very much. God bless every one of you, and I'll talk to you soon.